As we continue this topic of gastroesophageal reflux disease, I have just in my previous part, I have just discussed about the signs and symptoms of gastroesophageal reflux disease. But having highlighted the esophageal symptoms and extraesophageal symptoms, there are also symptoms that one needs to look at, which will help to lead into other diagnoses. Because as I said, that gastroesophageal reflux disease is something that sometimes is missed out or is confused with something else. So someone needs to actually watch on alarming signs, which are as follows. One of the signs is early satiety. Early satiety, this simply means that when you feed or when you eat, you get full easily, even without you have just eaten a small amount of meal, but you feel that your stomach is full. This might mean something else, might direct us to something else, which might be either CA of the stomach, that is cancer of the stomach. And then another thing is somebody will have a symptom like weight loss, excessive weight loss. It might result to either CA of the esophagus, that is the cancer of the esophagus. And if you might delay to take precautions, you might find that you are concentrating on GERD, but it is something that needs immediate attention. Another thing is you might experience GI bleeding, that is gastrointestinal bleeding. So it's good when we find the source of the bleeding, because we will not only concentrate on gastroesophageal reflux disease, but it means maybe you might be having bleeding varices or something that needs an action to be taken immediately. Another alarming sign, is anemia. Anemia simply means that you are losing an excessive amount of blood, which has special components like iron that will make your immunity to be weak. So we need to also look at this. So when you experience these particular symptoms, it's good when you seek immediately attention, because this will help to direct the diagnosis to something else, whereby you might find that you have been treating GERD for a long time. You have been told it's GERD, but it's something else, which might be the CE of the stomach, that is the cancer of the stomach or the cancer of the esophagus. It might be bleeding varices, and so many other things that we might not also I might not tackle them here. So kindly look at these alarming symptoms that I have mentioned above: early satiety, weight loss, gastrointestinal bleeding, and anemia. This will might lead you to some other differentials.